I think the first thing to say is that it's relatively complex. Most conditions are multifactorial, so there's normally more than one cause. What we do know with ADHD is that there's a very strong genetic component. It's quite unusual as a practitioner seeing adults to actually see people presenting with ADHD without some first-degree relative at least having symptoms, if not a diagnosis. And actually a relatively common presentation that I see, because I see adults rather than children, is somebody who turns up because their child has been diagnosed with ADHD and they've recognized that they have the same sort of symptom. And I have a number of patients who, in families where maybe all the siblings and one of the parents has exactly the same condition. So genetics plays a major part in the etiology. There is also some evidence that certain factors around birth play an important part in the etiology of ADHD. There's a higher than average prevalence of complex births in children who go on to develop attentional problems. So forceps deliveries, breech deliveries, prematurity, post-maturity, large babies with large heads, all are associated with the later development of these subtle concentrational problems. And we think that the reason for this is to do with subtle, or sometimes less than subtle, interference with blood flow into the sensitive areas of the brain at the time of birth. Which is not to say that children who go on to develop ADHD have overt brain damage. It's just that their frontal lobes particularly have been sometimes slightly compromised at the time of birth. A smaller but nonetheless quite interesting group of individuals sometimes present after head injury. A classic example is frontal lobe injuries, motorcycle injuries. And I do have a number of patients who've gone on to develop symptoms indistinguishable from ADHD following a blunt injury to the front of the head through disruption of frontal lobe fibers. There is some evidence also of environmental factors, exposure to radiation. This is relatively uncommon. But it's also possible to develop something very similar to ADHD, for example, following complex radiotherapy and chemotherapy to the brain, for example, for certain forms of tumours. And I do have patients who've had those experiences. So basically, either genetic or certain environmental factors seem to combine in vulnerable people to demonstrate the condition.